So, hi everyone. I'm Dr. Manan Thakrar. I'm a consultant psychiatrist and I'm based in London. Today, I've got someone very special, a friend of mine who I've known for years and years, and whose work during the initial part of my psychiatry training in India inspired me massively. This is someone who has done his studies from India, who's currently working for Microsoft. Thank you, Mikul, for joining me today.
Thank you, Manan. Thanks so much for conducting this and inviting me, right? Like, great to talk to you once again.
It's lovely to see you too, yeah. Tell us a little about your career. Where did you do your studies and everything to get us some backdrop, and then we dwell right into it.
So I come from a close-knit Gujju family, right, in Gujarat, and did my schooling, all stuff here. Followed the hut, did an engineering. So I'm an electronics engineer from IIT Roorkee. Right. After which I truly followed my passion and did my MBA, which I wanted to do for a long while. So I worked at Qualcomm for a year, and then soon realized that coding. I was an engineer and soon realized that coding is not my forte. And I did an MBA from IIM Ahmedabad, which was super fun. I think that's where we met because I was also running the startup Mood Cafe, which I ran even after my MBA. Making funds in a sustainable way was a challenge. So from there, I kind of switched back to corporates, and currently I'm a product manager at Microsoft.
Fabulous. And yes, let's dwell right into Mood Cafe. So the idea of
Hmm.
Mood Cafe was something which, when I met you guys and we discussed for the first time, I found
Hmm.
absolutely fascinating. This was what year was it when we started discussing Mood Cafe?
20.
2018, 20. So I think one of the things, like just like we discussed before we started recording, I think today we
Hmm.
want to discuss a little bit about entrepreneurship in mental health, and someone having a background in management, I think would be a fascinating discussion for everyone who has worked or wants to work in mental health to talk about. So in your own sort of language, do you want to walk us through the whole idea of Mood Cafe? Where did you conceptualize it, and what the journey was?
See, the whole conceptualization started right from my undergrad, I would say. So at IIT Roorkee, I was a volunteer in the counseling cell, so kind of helping spread mental health awareness. So I was anyways aware of the space. And one fine day, a close friend of mine committed, a bit rather attempted suicide. Right, he tried to commit suicide. So he was like a very happy-go-lucky batchmate of ours, right? And he suddenly got to know like that this person has left a suicide note in his room and he has left. And it was shocking, like because he was like one of the most apparently sorted person I knew, and we actually searched for him. Like I literally helped go with the police. His father was in police. So I went with him. We went across the Ganga Canal everywhere. Talked to a lot of districts near, and there was no news of him, right? So and then for a week we were completely settled, like how what happened, all of it. Luckily, he came back like after 10 days. He came back to his home. We were very relieved, but for that 10 days we were completely shocked, and I started introspecting that if I see 10 of my close friends, I counted like 8 of them were like seriously struggling with something or the other. Right? It's some personal challenges, family, education, and number of people. So I realized that the space is like the problem is huge, and I also knew like I started researching and came to like one student commits suicide every hour in India, which was even more surprising. Like that sounded overhyped, but then when I reflected, I realized the actual count may be even higher, right? Because reports might have underrated reported. So I thought like let's do something, and that was always in back of my mind. Uh, but then as time passed by, after I left Qualcomm, I got this offer from IIM Ahmedabad, and I was actually thinking, should I do an MBA or should I get into like psychology and do a course in psychology, which was like something which I was more both are the domains I was quite interested in. Leave the offer of IMA because that was something I wanted to do right from my school days. So I thought, yeah, I wanted to do that, right? So I went there. Even before going to the campus, I actually searched like who are the professors, and I mailed two of the professors who were somewhat related to mental health or psychology. And I said, hey, ma'am, sir, I have got this PGP offer from IMA, and I'm going to join the next batch. And but I want to just meet you and like see if I can do anything in parallel for mental health. So that was always on back of my mind. I had not decided whether I'll start a full-fledged adventure as an entrepreneur or not. But in my first year, somehow there was a B-plan competition, and I thought, let's use this time to get some IMA people work for free. And that's how we kind of ideated like what can be done in mental health. We just realized this is a spectrum, and there's maybe a wellness center, a gym, something spiritual, some hardware device, some app, some website, counseling, whatever, right? We had no idea. We just thought that, hey, this is a problem, let's just explore and see how can we truly solve it at scale. So that's where this whole thing was born. Uploading one. So then, I mean, as time passed by, and then like I got into IMA. At that time, I was actually thinking whether to get into IMA or get into like psychology masters maybe, because both were like equally exciting. I chose MBA because that was like a long dream, and then IMA was something difficult to give up for me. But the moment I like accepted the offer, even before getting to the campus, I kind of mailed two of the profs who were working in the domain of psychology or somewhere related to mental health, and I said, hey, I want to work in this space. So I was always like keen there. As time passed by, there was a B plan competition, so I thought, hey, it's a good chance to like get IMA people work for free. So I kind of formed a team and then explored the idea around mental health, right? So we're like very open to build anything, be it a physical center, a hospital, a gadget, right? Like a hardware device, something into spirituality, sports, counseling, any other innovation, games, right? Like we're like uh, agnostic of the solution. The focus was like, let's see what can bridge the gap and help people at scale. Because all we knew is there were some people going to counselors, but there were very few of them, right? Even in places where counseling was accessible and free, right? So that is where we thought we'll do something. So like this was December 2017 when I hired a few folks just like interns across India, just like researching the problem. So we talked to people, interviewed, conducted all sorts of research surveys just to understand the space for a month. And then as a next step, I hired 12 psychology students as like, to give them a live project, and then divided them into like 4 teams of 3 each, and gave them the same problem to like come up with a way for people to know about their mental health and take care. So one team developed a game, one developed an inventory, and that was pretty interesting. But the best outcome was that I got to learn about the space, because I was very cautious from day one that I am not a certified mental health professional, and that was very clear in my mind, right? So all I can do is maybe help facilitate and empower the experts, right? So that is where like I kind of always made sure that we had the experts around us, so that we don't like deviate from the field. Then we did experiment a lot this way, right? And we even started with like a typical online plus offline counseling model where you can connect with counselors over a phone or a video call or face to face. But we realized that that's not solving the problem. That's always already there. What we wanted to help is people like those 8 out of 10 of my college friends, which I was talking about, right? People who kind of uh, needed help, but there were lots of barriers. So we thought, let's say there's a person X, right? Let's say Mikul needs help, but to take help, like this is Mikul. Let's say Manan's going to give help, right? But there's like lots of barriers. First, is Mikul may not be aware of the problem. He may not know whether it needs solution at this time or not. How important it is. He may not know where to go to or whom to go to. Even if he knows, he is worried about his confidentiality. He's worried about like paying here, like he doesn't want to pay, right? And it's just about commitment or showing his face or confessing honestly. So there are lots of barriers. So we thought, can we do something that breaks all these barriers? So then that's where this whole idea came up, where we built a free anonymous chat app where you can chat without giving your details with a trained listener who was just someone like you, but was they had taken a small training and cleared a screening from Mood Cafe so that they can non-judgmentally hear. So it had a lot of science around active listening, so they were trained on those aspects, and the idea was to help the person get the first level of help and went out, and if needed the user could then connect to a counselor, and in extreme cases we had also tied up with a suicide helpline partner to help the people who are in that self-harm state, right? And so now, if you see the same example of Mikul and Manan, right? Now, Mikul doesn't need to show his name or anything, right? He's not worried about confronting face to face or his confidentiality being breached. He doesn't need to go anywhere, right? Mobile is something which he uses, right? He uses WhatsApp, so this is just another app for him. It is free in it, right? Like we tried multiple models where you can pay later if you want to either talk to a counselor or if you want to give back to the system. But initially, you can try out for free. He's talking to someone who's like some very similar, so it's like comfortable setting, right? So and he doesn't need to worry about like investments or like what would happen, all of that. Just try out, right? So kind of we had broken all the barriers, and then we connected them to listeners, and eventually like people are very happy with this, right? They were actually finding a lot of value, but that's how like Mood Cafe was born and evolved.
Interesting. In the first step, you mentioned that you got 3 different teams of 4 psychologists to sort of
Yeah,
research into
yeah,
the whole problem. So tell us more about what were the findings or what were the things that they developed. You said that one of them developed a game.
yeah. So see, and that game was the most interesting one. So basically, what we did is, uh, so there was no Indian specific inventory or an assessment of mental health, right? With like core Indian data. And because our initial target market was India, I think we felt let's build more original, but also something that connects, right? Because people always find like filling these forms tedious, right? Service tedious. Like it's not a survey; it's more like an mental health questionnaire, but people find it tedious. So what we did is we built like an inventory, but then put it in a game. So it was actually a role-playing game where, let's say, you take the role of protagonist, and you need to make certain decisions in your life. Like, say, you wake up and how you treat, like, you get a phone call. So, would you want to like treat your wife first, or take the phone call in the early morning, and then someone needs help? Will you go to the office on time, or will you help this person, and so on? So, as and when you make decisions, the next story keeps building up in that game. And by the end, you're completed the game. It is fun, but the outcome is each game was like a corresponding question to this mental health questionnaire that we had built. So in the end, you get a detailed assessment of your mental health. So that way, you're giving more natural responses without thinking about like what is right, what is wrong. It is fun, and you can go deep, right? Like generally, the thing with questionnaire is like the more questions there, the better help you understand the dimensions, right? To get statistically significant answers, and that is where like this was. Uh, this is like we felt that this could really work out well, right? So that was the most creative one. And then there were other teams who like built similar like inventories, and there was a team who was not able to do something, which was totally fine, right? For the time bound activity. So that's how we kind of worked there. Yeah. And I got our head psychologist from this group, right? Who later on joined our team to head the psychologist.
Why didn't you go ahead with that game idea? Because that sounds fascinating.
See, again, we wanted to like the whole idea was to bring any possible barrier, right? Filling a boring questionnaire was one thing, right? I actually asked people like so we started with a simple questionnaire first, and we were asking people to fill it, right? Uh, they were like literally doing it just because like they wanted to be nice, right? Like more than like they being interested to know about themselves is what we I realized with some were really curious to learn, but I mean somewhere that used to be difficult, right? And they were like, in fact, not just this, right? Even if you ask someone to fill any such questionnaire, I did a research by the way at IIM Ahmedabad. So with this professor I talked about, right, who was into like psychology, she's a very senior professor. So we got an option to like do a research instead of take and drop a course. So I did one. I did a research which was tangent and all. What is the response rate of people when you ask them to chat with a bot rather than filling a survey? Like this was we chat GPT. It was not AI. It was a simple bot we made, and you might be surprised. The response rate doubled. So basically, I reached out to random set of people, and about 9 or 10% of them responded to the survey, but the response rate on the bot was 20%, just because it was interactive. So you can imagine like how much the game would have benefited, right? That was like interactive plus fun,
Yeah.
right? So and then the potential, we did not go forward that much because an assessment from an ethical perspective needed reliability, and like there's one more thing, right? Test which needs like 6 months of gap, right? For the to like get an authentic inventory validated validation and reliability test, I guess. So we did not want to bypass any of those. Like ethics was like very strong at Food Cafe. So but we somehow could not complete it. So we did not go ahead like formally doing it. But in that whole ideation pilot, I think it was like going really good there.
It sounds like a fascinating idea. So yeah, if you mean like from biostatistics point of view, I think we're looking at validity and reliability. So I
Yes,
think what you're
validity
saying
and
is that
reliability.
yeah. So what you're saying is that probably the validity was okay, but the reliability was not too high.
No, no, it was not about not being too high. The thing is, to
Hmm.
achieve this, I think you need to administer it to the same set of people after a few months, right? So
Right.
it is
Yes.
not a
Yeah.
business call. So we did not even try it because, see, we were a startup and initially fund out of our pockets, right? And later on we did get funds, right? But this is where like we had to prioritize our investments, right? Like business aspect also comes in. So our focus was more on building the app and launching it, because had we taken it, it was very costly. Like game building took like, we did it fully with interns, but it took like 2 months just to build one story of the game, because we had needed graphics and everything, right? So it's just that our priority as a business was to kind of reach and help people faster, grow our user base, and this was more like an acquisition channel for us. So which was a heavy investment. So we just parked it for later. Like we thought we'll build it. It's promising, great, but there are cheaper ways of getting more users and helping them. So first, let's start building the core of it, which was active listening. This was more
Yeah.
like a side product of that whole intern activity, right? So we thought we'll do it later.
Right. Yeah. Yeah, probably. I do appreciate the whole idea of then working on the graphics and then it becoming primarily a gaming company rather than a mental health startup focused on providing some sort of a
Yeah.
therapeutic intervention. Okay, so take us back a backdoor into the whole finance side of things. What goes into? Tell us the whole story about Mood Cafe first, and then also if you want to shed some light on how financing behind startups work.
Sure. So let me talk about the cost side of it, right? So I was blessed to be at IMA. That gave us a lot of things free, right? Like we're getting interns from IITs and different good colleges for free, because officially they were staying inside the IMA campus and working right in the incubation center. So they wanted that experience, and so like that brand name helped us get like interns easily. Um, and we did put like some money from our pocket, but very early we were like lucky to get help from our alumni. So PGP 91 batch of IIM Ahmedabad, right? They have this thing called Social Mavericks, where they help like social entrepreneurs, and so they guided us, they funded, they gave us like free scholarships to like not just take care of our startup, but also take care of me and my co-founders basic expenses, so that we can be fully focused on our startup. So that's what we got. Government of Gujarat helped us with some startup grants. So with all of those money, initially, I think Dr. Ashok, who's our common friend, right? He was helping us. He actually used to stay in our office sometimes at night just to help us guide and structure things. And his company interest has also helped build the initial version of the app. So that way, like you helped us, right? You guided us a lot on training. I think training the listeners, right? Initially, so that way, like we were very lucky to get like help from a lot of great people. So that's how we initially managed. Right? But then, like once we were in the market and we had to scale, we then took serious funds, right? So again, the lead investor was from this IMA 91 batch, and Nish, and he, along with his network, I think they invested in us as an angel round, so that helped us move. Now talking about the revenue side of things, right? So all these ideas were helpful, like to the user. Uh, in fact. we had like cracked the model. Like even cost wise, one more thing is like getting users, right? So we did interesting ideas. Like our team was like, I'm very proud of the team. They're very innovative. We did world's first time donation camp where like people would come to donate their time and like hear out someone, right? So I think you knew of it. So that's what we did. We used to do camps to get listeners, and earlier we were worried like why will someone volunteer and listener, but interestingly our listener to user ratio was such that we were level less of listeners, 200 plus listeners, and that too. Uh, can you guess like if someone wants say 100 people want to become listener at our platform, right? How many of them would actually become after clearing the screening and like taking the training? Can you guess like as a business how many should we ideally clear?
Say around a little more than 50% at least, one would like to say.
Because it makes sense. Right? Someone is coming for free to help us, right? But you might be shocked. Only 4% were cleared. 90. We used to reject 96% of people who wanted to become listeners. We are so strict on our ethics that we wanted to bring quality listeners. So that way, we went against the business principles, but that helped us get quality listeners who stayed for a long time, and there were many more who wanted to come there. So all of that was sorted. Our app download we had brought down to 3 rupee per app install, right? It started with 20 and then got to 3. So everything was sorted on the call. The thing is, when it came to making revenue, people didn't want to pay. That was the reason we had to shut down eventually, because while people were happy, even so we tried like pay for counselors, but people were like after venting up, they didn't want to get to a counselor or pay there. Right. Within counseling, we tried all sorts of pricing experiments, right, and research-driven pricing experiments. So that didn't work out. We tried B2B, but this was like pre-COVID. We had shut down like in the end of 2019, right? Just like months before COVID came. So these businesses were not so invested in mental health. So B2B at that time didn't work out that well. Now I think businesses are starting to invest, right? But that was the case. Eventually, we also tried a pay what you want model where users can talk to listeners and chat with listeners and then pay whatever amount they want to. But right, and then people were happy. We knew people were happy because we observed from our data that after like 60, 70 conversations, like messages, more than half the users actually thanked the listener heartily without being asked for. So that's why like they were so happy, and our Play Store rating was high. We were once in top 10 health apps on Play Store in India, above Google Fit. So like all the stats were showing that people are finding value. But when it came to payment, we ran this pay what you want model for like 3,000 users, and you might be surprised, only less than 20 people pay, and that to like less than 500, like less than $10 basically, right? So that kind of helped us confirm our hypothesis or rather invalidate our hypothesis, right? Like, and that was like very clear, black and white, that hey, most of the folks are not ready to invest money for their mental health, right? At that stage, at least. That's what we concluded from this experiment. Maybe we might not have been giving the best product, the best value, we might have done something wrong, but at least with all the approaches we got, this number was too low to even take up, right? Like our model was like out of say 3,000, even if 100 people pay, we could try to take this 100 to maybe 500 or 1,000, right? We can try ways to do this. But 10 was such a small fraction that whatever we could have done, we were somewhere convinced that like getting people to pay for their mental health would have been the best. So yeah, I took a flight, met my investor in a cafe, and he actually said like, do you want more funds? I can get you. And I said no, like that might waste others' money, right? Because somewhere I think there was all sorts of data telling us that hey, for this model to be sustainable, we might be too early, or maybe in the wrong market, right? So that's where we then shut down. So yeah, I think somewhere finance was a reason for shutting down.
I think Mikul, you're very right in saying that Mood Cafe was probably ahead of its time. Like if say you would have sustained for 6 more months, and in the middle of the COVID pandemic, I think Zoom wasn't making a lot of money before the COVID pandemic, and then the COVID pandemic hit and Zoom just skyrocketed completely. And I think Mood Cafe as a remote mental health service provider was probably like, of course, what were the let's talk a little bit about what were the competitors in the market as far as when you devised the idea of Mood Cafe. What were the top 5, top 6 mental health startups in the tech industry that you sort of looked to?
See, if I talked about India, right? So India, there was like there was one player, one-to-one help, right? And I happen to know their founder, right? Like they've been persistent for like more than 20 years in the space. They're into core B2B tie-up and they're giving quality counseling. So they were doing good, and they were masters of their space, and they were like doing that, right? And their
Who is this?
platform,
Sorry,
like one-to-one help.
one-to-one help. Okay.
So interestingly, the two colleges I studied at, IIT Roorkee, IIM Ahmedabad, and the two companies I worked, like Qualcomm and Microsoft, all four had tie-ups with one-to-one help. So I mean, they had great tie-ups in like corporate colleges and all, right? So that was, I think, B2B counseling, right? And they're good at their job. They're doing this, and there were other likes of it. I think Inner and your those all of those. But they're more mainly into counseling. Now there's one platform, Visa, but like which was like by in folks in India and Europe, but their majority user base I think is from US. I think so. I would call them as US startup eventually, right? Where the users like. And many other innovative platforms were largely bought and Visa. This is Visa, right? So 7 Cups. A lot of these are like were in Europe or US largely, right? Who are doing some innovations, right? Be it AI based bot, be it into like mindfulness and Headspace. Headspace has been pretty big, Headspace and better health at times. So I think these were the players who were kind of in the space. Very few who were like doing core innovation outside counseling in India. We're one of the first ones. In fact, today it's the other way around, right? Like after COVID, over 20 people reached out to me that hey, I want to start something in mental health, and actually have created a WhatsApp group. Like anyone who reaches out for mental health, like put them in the group and like get people connect so that they can like find synergies and do something, right? I like really want to see a big mental health firm come out of India, but honestly, I haven't seen it that has been like truly able to solve the problems in the space.
I do see like a lot of remote service providers, like BetterHelp is one. I think
Yeah.
a lot of like non-mental health focused, but just healthcare focused, like your Tata
Mm-hmm.
health app, or I think there are a couple of apps which will provide B2C, like
Yeah.
for all the new listeners, B2B is business to business and B2C is business to customers. So either your company can directly link with another company and provide you the healthcare or facilitate the needs that you have, or you can as a customer just go on say Librate or Tata and just book a doctor or book a psychologist. And I think those the B2C side of things is massively picking up, isn't it, in India at the moment?
See, I still again this is my personal take, and I'm not as closely involved in the space. I was doing Mood Cafe in terms of like understanding the market, but what I've seen is like I haven't seen someone crack the problem at scale. Right? There are two problems I see. One is they are just scaling like counseling online, right? Which was always been there, like BetterHelp and others. So which is a good thing, which is a great thing in fact, right? Like you can, I've used these services like talk to counselors at home. But beyond those, I think other ideas, I think I've still not seen them monetize at scale, right? Like they come and go and shut down, right? Very similar stories to Mood Cafe. That is one. The other thing which I feel, right, and I'll be harsh here, but that's what I've learned is there were countable number of reliable counselors in India. Like when we were hiring even for Mood Cafe, right, in our team of our experts, like, and that's what our head psychologists and others felt that knowing people, like people do get qualified, right? I think that's one barrier, right? Like a lot of people counseling without qualification, but even let's say you exclude all of those, right? People with qualification also, I feel at least particularly in India, have not been so well understood to like truly get the space. I feel like beyond like their theory, and one potential reason I think is a lot of people happen to take this as a backup career. Like that's a harsh truth, right? Like not everyone takes psychology by choice, right? But given that how it is, I think there are limited good graduates getting into the space. So doing something at scale, right? And I mean, being from IM, there was an opportunity cost for with a high paid job, right? I would definitely think of doing something that helps like a really good number of people. So I think there also somewhere I think then scaling online counseling would be limited. So
Mhm.
that's just my take. I mean, I may be skeptical, but
Yeah.
at least I haven't seen someone innovate making mental health accessible beyond online counseling in India right now. Actually, right? There are foreign players, but I think none in India that I have seen.
Yeah. Yeah. I understand that. And the other thing that I wonder, as far as the back end side of things is concerned, you said that initially you had help from alumni and people like Ashok. What
Hmm.
sort of numbers are we talking about, if you don't mind going into the depth of it, as to say monthly running costs with how much staff? Um, and-
Cost was like in just a few tens of thousands. Like, so I have a kuchu, right? So ultimately that came away. Like we are being as scrappy as possible. Like we were like interns with less than 5,000 stipend. We had developers, marketing, psychologists, everyone paid like on an average like 25-30K a month. So we got great people, but like we were extensively like getting to like hire people who were okay with that cost. But then we tried whatever we could to bring their like food and accommodation costs down, right? So the manpower cost was a big cost in the whole because we were a tech company, right? So generally manpower is the biggest cost, but that helps. Our server was free, like with the innovation incubation center at IMA, right? They had tied up, so we got Google Cloud, AWS both. So we got like free cloud. Our space was like nominal cost. Uh, CII later started charging us, but initially it was free, and then yeah, that was an expense, but that was fine. I mean, not so high, right? Uh, and our app development, like which was roughly worth 10 lakh of the label cost, is where InfoStretch helped us, right? Ashok's company. So that kind of help us uh, reduce the app part of it, like get the first version out without like paying cost on us, which could have been otherwise the largest cost. Go to market was very nominal, like it was more about like crazy, almost free ideas. So that was free. Acquisition was another larger bucket. So getting users was like is always a big money, right? Marketing, but with all the A/B tests, our team was able to bring them down from like 20 rupee per user to 3 rupee a user, and we had 20,000 users. So like we might have spent like a lakh or two to get them, and we had 1 lakh followers. So things were like helping on those fronts. All in all, I think the numbers like it was very random, right? Generally few tens of thousands, and towards the end it was like in a few lakhs. So
Mhm.
that's where, yeah, I won't disclose the funding we raised
Of course.
without
Yeah.
investors' consent, but yeah, before that, like this was the grant. Government gave us like up to 20 lakh of I think government grant. So that was so all that money and like the alumni money. I think we were fairly able to sustain like with our development and operations, all of those.
So, as far as like a couple of follow-up questions on that, you
Hmm.
said that with an investment of roughly say a lakh, you started, which is roughly £1,000 or 1,200 to 1,250 US dollars, just like giving a
Hmm.
rough estimate for our international audience. What sort of interventions did you do as far as marketing is concerned to get this catch people's eyes essentially?
See, initially it was all friends, like reaching out to people, asking them to reach out to people, right? And some happen to have good following also in my batchmates from IM and all, right? So that was the initial one. We started going talking about it in different events. Uh, we conducted like this workshop with colleges. We literally went on like some street events, right? Like the good thing is our team was like super young and we're not trying to do anything, right? So we just used to make all the billboards. I talked about this time donation camp which is the first of its kind we did, and like we invited listeners and users, like people to just come and one on a coffee table setting, one person would first take the training by coming a few minutes or an hour earlier, and then after that they used to talk. So that was like an offline replica of what we used to do, right? So
Hmm.
that gained traction. Some celebrities, I think, Sudhanshu Pandey, Ravi Dubey, a lot of those people actually came there, right? They didn't charge anything; just came to support our cause. So uh, right? So many of them kind of helped spread the word. Online, like Facebook, we actually did courses and learned digital marketing ourselves and did those A/B tests and to kind of run some digital ads, but very nominal cost. And we were doing very targeted marketing. Like we had identified around 20 target groups, and target groups meaning like, hey, a young student studying in Kota, a widower, and so, like very focused group who we thought like would almost definitely uh, want to try it out, right? Spouses of army people, right? Like people we knew that they would definitely want to talk to someone, right? So like on a like high probability. So that's how we kind of started doing non-scalable activities because initially we didn't have funds and kind of started getting more and more users. Listeners was like word of mouth. We tied up with 2, 3 clubs of IMA, and then together we got some from IMA, some from nearby. So psychology students, a lot of psychology students were interested because it's also like helping them learn, use their skills, right? So we got psychology students, and we did camps at certain places where people from different age groups came to become listeners, and some we didn't even know because it was all full tech, right? So we didn't even like know a lot of people. But yeah, I mean, no, at least I didn't know. Like they were definitely trained by a psychologist over a video call, so they would know. But that's how the whole system was. Like, uh, so people kept coming organically, like after initial few efforts. And media
I
helped for
remember,
sure. Like yeah,
yeah. Yeah, I think there was a lot of positive coverage in the media. I remember being
yeah,
closely involved with this. So I know that we did an event in Bombay, we did a couple of events in Ahmedabad. One of the things that, back end, you and I have had a lot of discussions about was the idea of the complaints and the legality, the legislation, the indemnity side of things. We were really afraid about, I was really afraid
hmm.
about, and I in all honesty, I did express my concerns about the fact that
Yeah,
we've got people who aren't trained in the field of mental health dealing with people who
hmm.
are in a crisis situation. You told me that you had an active user base of 20,000 people. With what sort of numbers are we talking about on a daily basis at its peak? Uh, how many active people did you have approaching for sessions on a daily basis at the peak of it?
The chats were like a few hundreds, like 300, 400 or so, right?
And
Yeah.
yeah. And did we have any complaints? Did we have any legal issues at all?
See, I'll tell two things, right? One is so we that was a concern, right? After you said that concern, we did act on it, like that hey, legality could have been a concern. So we got one of our like Dr. Soumitra Pathare, who is one of the chief like architect behind the Indian mental health law of 2017, right? And he, I think, is a director of the mental health law college in Pune. So we approached him and got him be an advisor to us, like guide us. So that way we knew that one of the biggest person in this space in India, the legal aspects of mental health, was kind of guiding us. That gave a lot of confidence. From day one, uh, more than like we got lawyers to like draft those user agreements, everything, right? So that was in place even before like we had launched, which generally startups don't get into. But because it was a sensitive space, we did that. So that helped. Uh, from we had partnered. So for suicides, we had partnered with an authentic suicide helpline, and not just like from a compliance angle, like truly authentic. I actually googled up. I called up 5 suicide helplines. 4 of them did not pick my call. We did not talk to them. Like if you're not answering the call at the time of need, we can't count on you. Right? The fifth one so called us back, and with them we tied up, and they were really helping. Right, so that is how we like made sure that every point, right, listening. And when I said like only 90, like 96 out of 100 people used to get rejected, right? Only 4 used to get that. That's primarily because we were very sure on quality, and our training was very strict to tell them we are not counselors, right? We'll only get like and all our counselors were certified there to upload their certificates all of them. Not that because they are practicing counselors they can be on board. So we were very strict on their training. And then we also used to test the effectiveness via interviews. So it was both like screening the experience and our psychologists kind of screening them again. So everywhere we knew that we'll make it so effective, plus we'll back by all sorts of compliance that it was covered. right? So we're like legally covered. We were practically also covered that, hey, everywhere we were so confident on our quality that our listeners will do their job the right way. We had counselors who will be available. Our suicide helpline was one click away. That people who needed help were in the best possible way directed. And the most proud thing, whenever I talk about like what did you achieve in Mood Cafe, one thing I say proudly is in this about 1 year when we were in the market, we saved 9 lives. That is something I'm most proud of, right? And that is where this whole ecosystem had. Like one of them, so I was also a trained listener. Luckily, I was able to clear my R test, right? Not all our team members used to, by the way. Some of our bootcamp employees were not was rejected from the test and they're not allowed to be listeners. But I was somehow able to, luckily. So one fine day, someone called, like I mean, on the app actually, and then she also called up mood and the listener was maybe not. I think no, sorry, the listener was not there. But then she called up our number and I had the phone that time. So I was like coming out of meeting, I picked up, right, because there was a missed call, and she said like, if had you not picked up, I was about to commit suicide. And I was stopped. And though I was a trained listener, I was like frightened on what to do, because like I'd never faced this in my life, right? Like someone was counting for her life on me, and in spite of doing all of this, I had shaky feet. But I was like choosing words. I was taking time to choose what to talk to. But I gave her some assurance, and I used some of my listening trainings on using the words I can understand, listening, all of those. And I tried to minimize talking. And I immediately suggested, can you please for me talk to this expert? And I immediately called up our suicide helpline partner and connected the two. Right? And so she was like crying and like in her room locked with her chair, and very, very scary situation. But then, and they connected, and then after an hour she called, and she was like laughing like crazy, and she told thank you and God bless you like more than 10 times, I think, in that call. And she was like sounding very happy suddenly after that one call. I don't know what even today I don't know what her problem was, what did they talk about, but somehow that helped, right? So the ecosystem we had built was such that all these risks kind of were covered, and we had examples to say that they were covered well. We never got complaints. We never got to complain of this compliance or these things, luckily. But I'm sure we would have got complaints if we were like beyond those 20,000 users. But those 20,000 users, I think none of them complained. Right? Not that that's a proof that wouldn't have happened for future, but somehow like that kind of gave us a confidence in the systems we have built and all the trade-offs we have done to make sure the quality is high. All the business trade-offs we did.
Yeah, I think one thing that I've learned working in mental health for the past 6-7 years is that honesty and empathy comes across very clearly. So if you come from a place of even if someone is in a crisis, even if someone is, I've seen massively psychotic, where they have hallucinations, where they've got delusions, and they're massively struggling with their mental health. They don't have insight into their mental health needs either. But if you approach them with a lot of empathy and with a lot of honesty, it does come across that, this person is out there with no other alternate motive but to be there for me and help me through this crisis.
Yeah.
And I think with you guys, with your team, I've got to say that I was really proud with the effort that you guys put in. And it was always, whenever I was associated with you guys to do an event, or whenever we were having those back channel conversations with the listeners, it was always a fascinating conversation, because your honesty always came across as people who wanted to make a difference and people who wanted to put a lasting impact. I wonder, having gone through the whole journey, Mikul, that you've gone through, how would you do things differently today if you were to start a mental health startup? Because I know a lot of our listeners would be people who aspire to do something in the field of entrepreneurship and mental health. What would you do differently?
So first thing, I'll call you and ask Manan how to space now to think of it, right? Because like all the advice you gave, right, was like you're an expert in the field and you understand this innovation, right? So I think and all your inputs are very to the point, right? I think that's one thing I do, right? But keeping that aside, I think, see, one is I'll definitely like, one is I'll definitely keep the money aspect in mind, because that's important to sustain, right? I'll either start a not for profit, right, which I've been doing like in a personal scale, right? So I'll either get into a not for profit and scale something, or if I'm getting into a sustainable, profitable venture, I'll keep the unit economics in mind. And it's not just me. Like, I was approached by a few investors later asking like, how's this about a few startups, and like, what is your analysis of the industry? And everyone said like, I was just asking like, how do you evaluate mental health firms, right? So this is coming from like big VCP firms. They said we only, so generally mental health, our biggest checkbox is monetization. Uh, we have seen like none of the funded mental health players has worked out, so we don't fund idea state startups here. Like, there are like lots of innovations happening, but none of them has been able to fund like scale and make profit. So profitability is a key. So in mental health, like not doesn't apply everywhere. So that is one thing I'll see from day one. Day two is, can I scale, right? Like, for example, one idea which I think can help is, because I said we have countable number of good experts, right? Can we make these good experts more productive? So, and can we also standardize and help others do like the job better? So that's one space I would like to explore. Like, how can we give these people, like, you are make empower experts to help more people in a shorter time? How can we outsource their logistical activities to technology, right? So that they can become much more effective in a lesser time spent with their clients, right? So that's one space I would explore. Right. Other is like the core tech space, right? Something like the Mood Cafe model, but globally, right? We thought of Mood Cafe globally, but then we are not confident of that other market, and then didn't have the funds and all at that time, right? But um, I think solving globally would not just help maybe monetize; it could also help solve the time difference problem. Because one interesting data we saw is a lot of users used to come at night. Like, that's where they finally like, sab kuch ho gaya now, let like everything's done now, let me think of mental health. Right? So and then there may be other reasons, the science, biology reason why like people are feeling more low, but users used to come at night, but listeners were more available at day, right? So somewhere, if we have to go in a similar model, I think I would keep the global time zones in mind. So that's one thing. uh, yeah, and I'll see. I mean, these are like straight learnings from Mood Cafe, and others like we'll always see as and when we build on something.
I think one of the things that people sort of struggle to realize is, no matter how much of a good intention you're coming from, for you to be able to sustain it, it needs to be profitable. Because at the end of the day, we are living in a market where, when people are,
Yeah.
it's almost like I have seen for some people, and I'm not saying for everyone, and this is not only an India issue, this is a global issue, that people who work in fields where they are benefiting humanity in the form of, say, healthcare, or
Mm.
even any field where there is some sort of nobility involved,
Mm.
somehow profitability seems to be almost looked down upon. Like, it's okay if you
Mm.
make a very healthy amount of profit from selling a car, but
Mm.
God forbid you make a very good amount of profit from doing a surgery, because
Mm.
you are doing something that's very noble. And I understand that. I understand that it's a noble profession, but at the same time, for us to be able to make it sustainable, it is still people's jobs, and people's families are running from it. And I think that's where people struggle, don't they, to identify that, okay, this person is. And I think that's why a lot of people, with, like you said, with psychology, it's probably, for everyone, it's probably not their first choice branch. They usually go there because they didn't get admission in something else. Because at the end of the day, people also think, okay, how sustainable is this, or uh, how am I
Mm.
going to send my children to school, how am I going to send my family and live a comfortable life with this career.
Exactly. And like, see, the thing is, what they miss is uh, they don't see like the exact reason why these people can do something else, and still they are doing it all self-sacrifice, right? Like, not trying to brag, right? But I think so. My co-founder, right, Rahul, he kind of uh, Like he was working in Bangalore and he just like left his job to do this. For me, I was actually in one of the meetups. I think you were there, right? And one of the members said like I see these engineers and IITians like just getting into mental health with no background. How can you do this, right? And I mean, it sometimes hurts, right? Like we like maybe some people may be truly crossing ethical barriers, right? But I talked about like how we were very sure that we are not experts, right? So we actually just trying to facilitate the whole ecosystem by using our knowledge as MBAs, right? As entrepreneurs, where which maybe a psychologist may not understand the economics or the scalability, the operations, hiring, all of that, right? So we just try to like get empower these people more. So I think that is where people frown upon. I think one Ananya Birla, I guess, right? I mean, someone big, right? Who's like who started a mental health firm, right? Like it's good, right? Like they would have got like hundreds of opportunities to make like 10x the money they would have otherwise made here. But they're like choosing to do this thing just for the cause. I think that itself is a big step, right? And I think we should support such entrepreneurs and we should support them to make money, right? I would rather say rather than blaming them, maybe fund them, right, or get them 10 customers, right? Right. I think that's the minimum one could do to spread the word. I think that's the best thing someone could do, like as a way to give back. That's how I feel about it, and not just mental health, right?
Yeah,
Any cause for that matter, right? Health, education. I think we should look for unicorns. We should look for big startups in this space, right? That is a testament of how innovation can solve problems while helping help like make money as well.
yeah, yeah. I think lateral connections, especially, I completely agree that being someone who's a psychiatrist, I wouldn't know half as much about business administration, hiring, the tech backside of things as much as you would. And I think it's very important for people to collaborate across fields and promote each other's work. For me, if I feel that mental health belongs to me only as a psychiatrist, or me as a healthcare professional, that's completely wrong. That's factually incorrect. The idea that mental health belongs to everyone, we need to democratize it. Of course, there should be quality control. Of course, there
Hmm.
should be the legal side of things, and which I'm really proud of Mood Cafe, because we did do that with Mood Cafe. Like, you guys did make sure
Hmm.
about the legal side of things and everything, and the quality control. One of the things that I always wonder is how AI would, and you told me towards the initial part of our chat that you saw that with chatbox, the interaction usually increases as compared to, say, a form. But as far as a therapeutic intervention is concerned, like an actual therapy is concerned, do you reckon AI would be able to replace um, a therapist, essentially? Or
Uh, I I don't know about replace in today's world, right? But I can think of it can assist to a greater scale. I'll give you a few examples. At Mood Cafe, we had a bot called Moody. So the thing is, connecting to a listener was not instantaneous. Initially, it was like one day or a few hours. We had brought this down to 2 minutes. But 2 minutes is 120 seconds. 2 minutes or 1 minute, I think. But even 60 seconds, right? For that 60 seconds, getting the user to wait was difficult, right? So we introduced a chatbot, which used to talk to the user and understand some basics. That also helped the listener get some context, right? Uh, had if we had AI, this bot would have been like 10x more effective. That is one. Second is there's this good research-driven bot called VBot from I think Stanford, right? And they are into using CBT via an app. Now, a part of CBT is getting user do that daily exercise. Right? It's like how you do a gym or something, right? Part of it. I mean, you would know like much better than me, but what I understand of it. So those logistical stuff of reminding the user to do something and doing a check-in, right? Which is something which even counselors give us as homeworks, right? Like, were you able to do this, that? All of that, I think a bot can literally be your assistant, right? In Microsoft, we call it co-pilot, right? Like it can be a co-pilot in the journey to do a lot of things, and very similar. So, this so AI can help there. Diagnosis definitely, I think AI can do the initial assistance job. So a lot of doctors have these assisting people outside, right? Who like take the initial preliminary check. Maybe AI can help do part of that and also signal some of the potential issues to ask next set of good questions there. So diagnosis could be one way where place where AI can help. All of them I'm saying is assistive, meaning it may need to be verified by an expert, but it can save like 80% of the expert's time there, right? Listening to some extent, right? Like I won't be surprised if AI becomes so strong that you can't differentiate between an AI versus a listener when it's purely about listening, right? But yeah, I mean, it needs a lot of other stuff, right? Like making almost 100% sure that it doesn't go the wrong way, right? So there are those ethical AI considerations in place. But having said this, I'm overall optimistic about AI solving part of the cases, right? Even helping connect to an expert or a suicide helpline, right? Like it will literally like keep things in momentum, save lives. I won't be surprised if we see like a news saying AI saved lives, right? I think it can be more effective in this. It's the overall healthcare space. I think healthcare is a very good use case for AI if done the right way.
Okay, final question for today. Mikul,
Okay.
if you had unlimited amount of funds and unlimited amount of time, what would an ideal, universally acceptable mental health startup look like?
Wow. Can you give me like 1% of those funds or time? Right, let me think through, right?
Say money is
Okay.
not matter, staffing
Or
is no
time.
matter, yeah,
Just
or time
kidding,
is
right?
not matter. What would
Yeah.
the client look like? What would the app look like, or would it only be an app-based service? How would you
So it would, yeah.
walk
I
me through
mean,
it?
I'm just thinking out loud, right? Creative. Like, it would, since we stopped on AI, it would definitely have a good use of AI to like get people, talk to them, understand them better. It would have the core of Mood Cafe with like listeners and experts across the world. It would also have a lot of self-help ways. It would have community. Actually, these are ideas we had in our backlog, but we did not prioritize, right? So we thought of this, right? Blogs. It would have self-help resources, inventories. It would help communities so that people can help each other with small self-help groups, right? Access to, and assuming we had enough money to also get the legal control, we would also have psychiatrists like you on board. We could not do because of some legal boundaries, but I feel like getting them more reach is always helpful. So we could have got like more like verticals of different sorts of mental health experts, right? Beyond like counselors and basically anyone who came there would have got benefit, and not just when they needed like core help, but also like in the earlier stages or just to live a healthier life, right? A better well-being, right? Articles around financial wellness which could potentially help reduce stress, or how to manage your workplace, relationships, everything, right? Like a lot of self-help tools, games, which is around this. So all of this, and but then at the same time being clean so that the system knows what the user is here for, and then customizes things to give them a tailored structure. I'm just like,
Would you still call it Mood Cafe?
no, I'd use part of this money to have a competition and ask people for a better name, right? Right, but I'll not call it Mood Cafe. Like Mood Cafe, I think had lots of confusion, right, on what it is, and I think I think NHS has a blog called Mood Cafe, I think, right? So we didn't know it earlier, so somehow I definitely call it something else. But yeah, I think, but yeah, I think this just made me feel fun, right? Like think of all the ways we
Yeah.
could do. Mhm. But that's where business comes
Fun.
into place, right? That's where like it needed a team of developers, designers, researchers, and the psychologists together to prioritize ruthlessly and do like what important can be done in a limited time, right? That's where I was talking about why you need people who know business and tech. But yeah.
Yeah. Listen, this has been a fascinating conversation, Mikul, and I would love to have you on the podcast again sometime because I know you will be doing massively interesting stuff with Microsoft, and I know you're going to shine wherever you go. Thank you for sparing the time, and thank you for bearing with me through the whole technological issues as well.
No, likewise, and like always fun to talk, and I think enough said this, right? But uh, I like whenever I needed help, like you were very approachable that way, right? And and I used to ask the difficult questions to you, right? Because I had others in the team, but whenever the really difficult stuff, you would come up with tangible guidance, right, as a mentor to Mood Cafe. So I think really thank you so much, and with all the without any selfish expectations in mind, you're always there. You came physically at times, right? Which is it just after COVID, it's very difficult to even imagine, right? So I think thanks for all the help you did at Mood Cafe, and I think thanks for all the other stuff you have been doing, right, including this podcast and your profession to help others.
That's really kind of you to say. Thank you, yeah. Thank you, and I will definitely see you again because we've got loads to talk about. Thank you, Mikul.
Definitely. Yeah, thanks, Varun. Have a good day. Bye.